Well, it's time to get your medical questions answered live.
The number to call if you have a question for Dr. Zorba Paster is 270-9933. Zorba is standing by in his clinic in Oregon. Let's get to the phones, and we'll start with Mohammed in Madison. Hi, Mohammed. What's your question?
Yes, thank you. My question is about KN95 mask. It says on there, this is not a medical device. If I just wear this to the store, do I have to dispose of it just because I wore it out to the store and back home? Or can it be cleaned?
Not at all. If you're a healthcare provider, especially if you're in the hospital, that's when we change the N95s pretty much every day. For the most part, you really don't have to. And what we've discovered is that most COVID is spread through droplets from other people that are spreading in the air to you. But the answer is no. You certainly can brush it off. You can spray it with a little antimicrobial spray if you want to. But for the most part, you do not have to change it. You don't have to toss it. It's for regular use. They're writing not for medical use because those masks are manufactured differently.
Okay, but they're good.
They're good.
All right.
Yep.
Let's go to John in Madison. Hi, John. What's your question?
Hi. I'd like to know if a person had COVID-19 and recovered, does that person still need to wear a mask? Thank you.
You bet.
That's a good question.
100%, because we don't know whether or not, when you get COVID, whether or not you can get COVID again. And in fact, we actually know that you can get COVID again. There was a first example about 2 weeks ago in Hong Kong where somebody came in, had a fever, had COVID the first time because they have very good tracing in Hong Kong. And lo and behold, they came down with COVID again. So the answer is yes. Even if you had COVID, you have to wear a mask. And as far as we know, you may still get sick again, just like you can get sick from influenza, not once, but twice.
Okay, let's go to Jim in Lake Mills. Hi, Jim. What's your question?
Yeah, hi, Dr. Zorba. Yeah, in 2009, I got influenza, and I was sick for 2 weeks. I mean, I couldn't go to work. That's the sickest I've ever been in my life. I mean, I've never been that sick before. A month and a half ago, I got COVID. I'm 62. I got asthma. I had it for like 3 or 4 days. It was like nothing. I went and got checked.
Yeah.
And I was over. I mean, I did have it. I stayed home. I didn't work anyway, but I stayed home because I was home anyhow. And I got the antibodies. And once you get the antibodies, how can you catch it again if you have antibodies?
Well, first of all, number one, you got very, very sick with influenza. And every time you get influenza, you don't necessarily get seriously ill. The same with COVID. Some people get COVID, it's very mild. That's exactly what it's all about. And other people get deathly ill and die from COVID. So the big issue is you can't tell from one time to the next. As far as antibodies, we don't know how long those antibodies last, and we don't know whether or not the antibodies actually protect you from getting COVID again. And why is that? Because COVID is new. We don't understand it. You know, with measles, once you got measles, you had lifetime immunity. With influenza, for instance, you don't have lifetime immunity. And with COVID, the jury is out.
And how many colds do we get in the year?
Oh, yes, right, exactly. Right, you got it.
All right, let's go to Jeannie in Prairie du Sac. Hi, what's your question? Jeannie, you there? I don't think she's there. Let's go to Laura in Platteville. Hi, Laura.
Hello.
Hi, what's your question?
Yeah, the other night I watched the vice presidential debate, and they were talking about afterwards how Vice President Pence had, like, red eye. Is an infection in the eye a symptom of COVID?
No, not necessarily. Many people have red eyes, do not have a symptom of COVID. If you want to know all the symptoms, Google it. One of the primary symptoms is loss of smell and loss of taste. And then the other symptoms, fever, headache, chills, can be just the same as a mild cold. Or, of course, if you get shortness of breath, that can be very serious. But red eye, as far as I know, is not a symptom of COVID. Now, keep in mind, the vice president could have COVID. We don't really know because we don't have those records. He said he doesn't have COVID. But remember, a negative COVID test doesn't mean you don't have COVID. It means you may not have COVID because the tests are wrong roughly about 40% of the time.
Oh, 40%?
Wow.
That's right. Very high number.
All right, let's go to Steve in Monroe. Hi, Steve. What's your question?
Hi, guys, and doctor. I was born with only one functioning kidney, and they are giving me a prognosis of level 3 chronic kidney disease. Do I have to worry about being out in public with this COVID real bad?
You bet, absolutely. Anybody with diabetes, heart disease, hypertension, chronic kidney disease, any of those things put you at risk for having a serious problem, any medical problem, especially an infectious problem. So the first thing you want to do is get your influenza shot. And the second thing you want to do is limit the amount you're outside and make sure you wear a mask. But yes, the answer is if you've got kidney disease, you're at risk. Once again, it's a shot in the dark, but you want to make sure you don't get seriously ill because you already have a pre-existing condition.
Do we have time for one more call? Or all right, let's go to George in Beloit. Hi, George.
Hello, this is George.
Go ahead. What's your question?
I'm thinking about particle size. Is the particle of a COVID virus larger or smaller than, say, a particle of smoke? If somebody's smoking in a crowd and I can smell them.
Sure. For the most part, COVID is spread by larger droplets. Okay, so they're larger droplets. They're larger than typical smoke. However, and I say however, we now realize that these very, very small particles, because the virus is infinitesimally small, may also remain in the air for some time. And that's why we're really not sure exactly how long you should keep on a mask if somebody has passed through the room. And that's why we want to keep the mask on whenever we're in public spaces while we're in that space, because right now we don't understand everything. But it's the larger droplets that certainly spread most of the COVID.
Questions keep coming.
Yeah, good questions. Thank you for your calls today, everybody.
Zorba, thank you for your time. We'll see you next week.
My pleasure.
Good to see you, Zorba. Thanks.